Within this section, we're going to talk about treatment of initial infection and two core therapies that have been around for a long time, specifically metronidazole and vancomycin. And there are really two main studies that are quoted that are prospective randomized control trials that looked into the efficacy for metronidazole versus vancomycin. The first was a study by Czar et al., published a number of years ago now. Czar looked at a cohort of 150 total patients from 1994 through 2002. All of them had C. difficile infection. They were triaged into mild and severe disease based upon specific criteria and randomized to either receive metronidazole 250 milligrams QID versus vancomycin 125 milligrams QID. And then their outcomes were assessed. For those with mild disease, response rates to metronidazole were about 90% versus 98% for vancomycin, and recurrence rates were about 8 and 5% respectively. Within this mild cohort, there was no statistically significant difference between metronidazole and vancomycin, and this is why the original 2010 Infectious Disease Society of America guidelines recommended using metronidazole for initial non-severe infection. However, for those with severe infection, response rates to metronidazole were 76%, versus 97% for vancomycin, and recurrence rates were 21 and 10% respectively, statistically significantly different, which was why in those 2010 guidelines, vancomycin was recommended for severe infection. The other study that provided us with prospective randomized controlled data comparing metronidazole with vancomycin actually emanated from a study that was originally designed to look at telavimer, an ion binder that binds toxin A and toxin B. Unfortunately, telavimer was not effective, but Dr. Johnson, who designed the study, had two control groups, metronidazole and vancomycin. And within these two sister studies, we see that overall response rates to vancomycin were about 81.1% versus 72.7% for metronidazole, a statistically significant difference. This was largely driven by a severe cohort of patients where response rates to vancomycin were 78% versus 66% with the metronidazole. What we see, though, in this study, which was conducted between 2005 and 2007, was that vancomycin was superior to metronidazole even during that time frame. And this is the explanation for why metronidazole was largely removed from the treatment guideline and the update to the Infectious Disease Society of America guidelines in 2018. Vancomycin is superior to metronidazole, and recurrence rates are unacceptably high with metronidazole.